Now that you've had an opportunity in the previous discussion posting to consider healthcare as a human right, let's look at the globe, internationally and at the United States, and how it's perceived. In 1948, a right to healthcare was incorporated into the Universal Declaration of Human Rights and the Constitution of the World Health Organization. So internationally, healthcare is viewed as a human right. Further, the International Health Regulations, which is an international legal instrument that is binding on the 196 countries across the globe that are part of the United Nations, gives the director of the World Health Organization the important authority to declare a public health emergency of international concern. Specifically in the Universal Declaration of Human Rights, it states, quote, "Everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including medical care and the right to security in the event of sickness," end quote. Most developed countries have incorporated a right to health care in their constitution or have created rights to health care as part of the legislative process, usually as part of a healthcare system that provides universal coverage. This internationally recognized right to health care cannot be enforced in the United States unless it is found to be recognized by the U.S. Constitution or a state constitution or has been incorporated into federal, state, or local statutes. Healthcare providers do not have to provide services to sick or injured persons. This is known as the no-duty principle. While it is not law, professional code and ethics requires services to be provided if there is already an established patient-clinician relationship. If this relationship exists, meaning you have gone to a physician over the years, you now have a relationship, they cannot refuse to treat, and if they do, that's considered patient dumping. There is an exception to the no-duty principle in the United States, that being the Emergency Medical Treatment and Labor Act, or EMTALA. Put into place by Congress in 1986, its purpose is to ensure public access to emergency services regardless of a person's ability to pay. EMTALA is an amendment to the Social Security Act, and it imposes specific obligations on Medicare participating hospitals that offer emergency services to provide medical screening examination when a request is made for examination or treatment for an emergency medical condition, including active labor, regardless of the individual's ability to pay. Hospitals are then required to provide stabilizing treatments for patients with emergency medical needs. If a hospital is unable to stabilize a patient within its capacity, or if the patient requests, an appropriate transfer should be implemented. Please continue to the next video, M-Trainer Educating Healthcare, that will give us a brief overview of the Emergency Medical Treatment and Active Labor Act.